Good afternoon. Thank you for joining us for our Tuesday at 2 update on COVID-19, starting a little bit later than usual. But we are here and we have a lot to go through, so let's go straight into it. As of April 19th, there are 82,491 unique COVID-19 cases in Erie County since the beginning of the pandemic. In the past week, through the 7 days that were ending on the 19th, there were 3,264 total new cases. So we're still seeing some very high case totals. This is the equivalent of 355 total new cases per 100,000 residents for the past 7 days, which, as we've spoken in the past, anything over 100 is considered a high risk of transmission, and we are 3.5 times higher than that. Hospitalizations on April 18th, there were 347 COVID-19 patients in Western New York hospitals, 84 in the ICU, that's been going up. 303 patients in Erie County hospitals, this has been going up, and we'll talk more about that. 78 were in the ICU, 56 on an airway assist, and 4 died on that day. And we certainly offer our deepest condolences to those who've lost a loved one from COVID-19. As you look at the hospitalization data for the last 2 weeks, we have some very interesting information here. First off, 72% of all Erie County hospital beds are occupied. So we're a little keeping an eye on that to ensure that that we do not have a much higher rate where we're starting to get 75 or 80% of the beds are occupied. Having a little issue here, I don't know why, but keeps on muting itself. The increase in COVID-19 hospitalizations has slowed, but it's still 72% higher than it was 3 weeks before, so that's a big concern. 58% of COVID-19 hospitalizations are individuals 64 and under. So this is not like it was in the last spring or, of course, this winter, where the vast majority of individuals were actually older. I don't know why, but we're getting a little thing here from this. And this is an important thing. Can you please mute them? I need everyone to mute their phone on the other line. Or can you mute them all, please? Because I'm getting them. Even though I don't think I should because I turned the volume down. We're having a little issue, but we'll get through it. And this is something that is very concerning. 27 patients died in Erie County hospitals during the past week. So I think it's very important that we realize that we are not out of the woods yet. That as we've been seeing, increase in cases results in an increase in hospitalization and eventually results in an increase in deaths. And that's what we're seeing now, is an increase in deaths. So if you can, if you're media on the phone, please mute yourself. We are dealing with some issues where I'm getting a little bit of feedback from the media on the monitor here. So please mute yourself if you're media. And to the general public, we've had 27 deaths in the last 7 recorded days in Erie County hospitals. We have not confirmed every individual as being an Erie County resident yet, but this is very concerning. This is the highest amount of deaths we've seen in a 7-day period in quite some time. And then confirmed cases over the past 6 weeks. We actually, for the first week in over a month, saw a reduction in cases, a slight reduction in cases, though as a result of the numbers we're at, we're still at a very high rate when it comes to the number of new cases in the past 7 days per 100,000 residents. So we have seen a decrease in the weekly total. It was 100 less cases than the week before, and the cases per 100,000 actually went down 2. So I'm happy to see a slight decrease, but we're still very high and more than double where we were for the week ending March 13th. Now, new cases by zip code for the week ending April 17th. We've had some exceptionally high numbers as of 7 days, or cases, new cases over 100,000 persons in a 7-day period, including the 14204 zip code, which had, as you see, if you can see, 851 cases. So it's more than 8 times worse than it should be under the guidelines of the CDC. And I want you to think about this. It's nearly 1,000 cases out of 100,000. So that means for the population, nearly 1% of the population had new COVID-19 cases for the past week in the 14204 zip code. And then some of the other zip codes are very high as well. 681, 655. The city of Buffalo in the east side has a much higher rates than we've seen in a long time, and it is very concerning to us. So no area of Erie County is doing well. Some areas are doing horrible, and we are working with our partners to try to alleviate that situation, and we're talking with New York State because this is really concerning. When you think about it, nearly 1% of the population in a zip code tested positive for COVID-19 in the last week. It is really worrisome. We have a little thing. Oh, we had a little issue here. So hopefully that made a difference. Okay. So we wanted to look also at the confirmed cases by age group. And the thing that is still very concerning is the case rate remains highest in the 20 to 29 and 30 to 39 age group. Those age groups accounted for nearly 40%. 39% of all cases last week. And you see their case rates per 100,000 persons is above 400 and over 500. But we wanted to do a deeper dive because we actually, while we saw a decrease in cases, there were certain age groups that actually saw cases go up. And we're not surprised by this based on information we're going to present you. But the 20 and 29 to 30 to 39 age group had the highest amount of cases. But they still saw a slight reduction in their cases from the week before, but a certain age group didn't. Ooh, went the wrong way there. Here we go. A little technical difficulties today. This is what happens when you go to once a week instead of like we used to be. But the three age categories, when you break it down further, that had growth from week to week, from the week ending April 10th to the week ending April 17th, was the age category of 5 to 10, 11 to 13, and 14 to 17. And 0 to 4 had a decrease, but it was only one case. But you will note that the percent positive, so based on the data that we have, this does not include, of course, the tests that are done by New York State SUNY surveillance, and there generally would be no SUNY surveillance on the 5 to 17 age category. But what you see is the growth in cases, in raw cases from 5 to 10, 11 to 13, 14 to 17. And every other age category had a decrease. So this is concerning because it's showing us that the student age population is one that's still seeing growth in cases. There was a reduction in the positivity rate, but the case numbers still went up. And that's really concerning. In the 11 to 13 category, it went from 598 to 959, so it was nearly double. This is really concerning. In the 5 to 10, it went from 1,068 tests. It went from 153 cases to 183 cases, 5 to 10, 89 to 118, and 11 to 13. I was talking about diagnostic testing. And 182 to 265 and 14 to 17-year-olds. So we are seeing more cases in our school age category. And it is concerning because it's the only one that actually had growth in raw cases. And if you look at schools, we had the highest number of new cases in schools, which includes students, faculty, other staff that we've ever recorded. 642 new cases for the most recent week ending, which is the highest we've ever seen. And you can see the chart here and how it keeps on increasing. And this is almost all, not every case, but almost all cases are students, not faculty and staff like we saw earlier. They're students. So it's very, very disconcerting to see this continued growth in the school. And it's one of the reasons why we are doing our best to protect all with protocols and policies that are based on CDC policies to ensure that the recommendations we make to school districts are based on sound science and what we're actually seeing in the community today. Mortality data, we have unfortunately more deaths recently. As I noted, we've identified 27 deaths in the last 7-day period, but we haven't confirmed all those deaths being Erie County residents, but through April 15th, there's 37 individuals who've died in Erie County, and unfortunately we've seen increases in the younger age category. 2 individuals have died under the age of 40 in the month of April. 4 have died between the age of 40 to 49 in the month of April. And it's actually higher than we saw in the month of March in those age categories. We haven't reached the same total as the month of March, but we were only talking about 15 days. In the month of March, we had 61 deaths. The month of April, through 15 days, we've had 37 deaths. So if we continue at that rate, we will actually have more deaths in April than we did in March. The other thing that's very noticeable is the average age of death has dramatically dropped over the last few months. In January, the average age of death was 81. February 76, March 77. In the month of April, it is 70. So there are younger people who are dying of COVID-19 in our community, and we know it's preventable, and we're just going to continue to push which we always done, which is get vaccinated. With that, I'm going to turn it over to Dr. Burstein to go through Erie County Responds, a number of the things we're doing, including vaccine data. I do want to thank Kendra Schmidt, I didn't thank her early on, for being here and providing the American Sign Language. Dr. B. Hopefully this is all worked out.
Yes, hope so. Good afternoon. So let's talk about vaccinations, because that is good news. So as you know, the Erie County Health Department, we have 3 sites where we are consistently vaccinating people in our large pods. Those are at SUNY ECC South, SUNY ECC North, and the Key Bank Center. And then we also have pop-up clinics occurring throughout the week. So we have our new scheduling system in place, so you can see where all our vaccinations are occurring and make your own appointments at erie.gov/COVID-19/vaccine. So just to make it easier. Also, if you want to make an appointment, you can call 858-2929 and schedule an appointment. We strongly encourage people to schedule an appointment just so you get a lot of the administrative and the paperwork and the entering all the demographic data done on the front end, and you don't have to do it while you're in your clinic. However, most days we are allowing walk-ins, usually in the afternoon. So for example, today we are at ECC North and ECC South offering pods, and we've already opened up to walk-ins. So if you haven't been vaccinated, or you have some friends or some families, just come on down to ECC North or ECC South and get your first dose of COVID-19 vaccine, and start your way into helping us get into ending the pandemic. So just in terms of the amount of vaccine that is coming into Erie County, so for this coming week, the Erie County Health Department received 7,000 Moderna doses for COVID-19 vaccine, and then the state has allocated another 5,300 doses to other sites in Erie County, and that includes hospitals, healthcare providers, lots of pharmacies, so you have choices of where you can get vaccinated. Unfortunately, the health department, we are not expecting to receive any Pfizer vaccines, so we can vaccinate the 16 and 17-year-olds until the first week in May. So we are looking forward to that, to get our high school students vaccinated. Just want to talk about the good news with our success around vaccination in Erie County. So among all Erie County residents as of April 19th, 45%, or that's 400,012, and 78 people received their first dose of COVID vaccine, and among eligible residents, that's 55%. And then among all residents, 31% have received their second dose of COVID-19 vaccine, and that's 288,508 residents. And then looking at all the eligible residents, again, that's people who are 16 years and up, 38% have received all their full doses and are fully vaccinated with COVID-19 vaccine. So that is really good news. And the Erie County Health Department, we've made strong strides in contributing to those data. So we've administered so far 58,502 first doses and 43,273 second doses. So we want to carry on. We, unfortunately, we're kind of slowing down in our progress of getting people vaccinated. It seems like many people who have really wanted to get vaccinated have already vaccinated, and there are people who are left that are on the fence. But we hope we can get off that fence and come down and get vaccinated at one of our clinics, either our main pods or our pop-up pods in the community, or one of the other sites in the community. So the bad news in terms of vaccination is that we're still seeing so many disparities in the uptake of vaccination and our success with our vaccine program. So this chart is looking at our vaccine distribution in Erie County by zip code, and it's looking at the proportion of population of people in each zip code who have been vaccinated with at least their first dose as of April 17th. So again, you've seen this chart before. The yellow depicts rural areas, the green depicts suburban areas, and the purple depicts urban areas. And you can see that there's huge disparities, that many of the urban areas and rural areas have our lowest vaccination rates. Some of them are half of that of what we're seeing in the suburbs, more affluent suburbs. So we're really trying hard to work with our community partners to make sure that everybody gets vaccinated. Everybody has access to that ticket to be protected from COVID-19. And I just want to point out that again, it's not too late to get vaccinated. And these zip codes where we're seeing the lowest rates of vaccine coverage are also the zip codes that the county executive pointed out where we're seeing the highest numbers of COVID-19 disease. So it's really important to everybody get vaccinated. Just want to say a few words about COVID-19 vaccine and among immunocompromised individuals. So the hospitals have been very forthcoming, really great communication with us, telling us about the status of their admissions and in terms of COVID-19 vaccination. So recently, a handful of hospitals have reported just a few patients that have been admitted either just partially vaccinated or in some have been actually fully vaccinated. So they received their 2 doses, Moderna or Pfizer, or 1 dose of Johnson & Johnson over 2 weeks ago. And so some of those patients were asymptomatic, and they were actually admitted for other problems like trauma, and then everybody who gets admitted gets tested, so they were found they had COVID-19. However, some of these individuals that are immunocompromised and fully vaccinated were admitted because they were sick with COVID-19 illness. So just want to remind us that individuals that are immunocompromised, probably don't have as robust an immune response as we see in the general community. So, especially if people are immunocompromised, it's still so important to practice these preventive behaviors. And the family members around them, you have to act like a cocoon, and everybody else get vaccinated to protect their exposure. And we all have to practice these good preventive behaviors, because even people who've been vaccinated, if they're immunocompromised, they can get sick and they can get admitted to the hospital with COVID-19. And then again, want to remind everybody that it's really important to know your status for COVID-19. There is a lot of testing availability for COVID-19 in our community, and especially if you've traveled, it's really important that you know your status, because outside of New York State, there is a lot of COVID-19 disease, especially in the areas that we from Buffalo like to travel to in the spring and in the winter where it's nice and warm. So all you have to do is to be eligible to get a test is to make an appointment at 858-2929. You can get either a molecular PCR test, and those tests are available between 1 to 3 business days, or else a rapid point of care test, and those tests are of course available on site. So we are offering testing 6 days a week, so please give us a call and know your status. This is very, very important. So I'm going to turn it over for the rest of the presentation to our county executive.
Thank you, Doctor. I've been going around town a lot to clinics and other places and hearing reasons why people don't want to be vaccinated, and some of them are just out and out wrong, and we're going to talk a little bit about that. But I've also heard from folks who were talking about their opinion on what we're doing, and and how we're responding to the COVID-19 response, but it's not based on facts. And I want to remind everybody of a famous quote from the late Senator Daniel Patrick Moynihan, one of our great senators. I had the pleasure to meet him in the mid-90s, and just a brilliant man. But he had this famous quote that I think everyone remembers: "Everyone is entitled to their own opinion, but not their own facts." I think it's very important as we're dealing with the COVID-19 pandemic, and we're still in the pandemic, and the vaccination process, that people understand what the true facts are. So we're going to go through some myths and facts here, because I think it's important for people to understand the safety of the vaccine and the issues that we are dealing with. First off, big number one myth: the COVID-19 vaccine alters your DNA. No. The COVID-19 vaccine does not change or interact with your DNA in any way. This is straight from the CDC. There are currently two types of COVID-19 vaccines in the USA: messenger RNA, otherwise known as mRNA, and a viral vector vaccine. Both types deliver instructions, genetic material, to our cells to start building protection against the virus that causes COVID-19. However, the material never enters the nucleus of the cell, which is where our DNA is kept. This means the genetic material in the vaccines cannot affect or interact with our DNA in any way. So if you've heard something, if you've seen on social media, if Aunt Jenny posts it, haven't talked about Aunt Jenny in a while, but if Aunt Jenny posts on Facebook that she's afraid to get the vaccine because it's going to affect her DNA, the answer is no, it's not, Aunt Jenny. It does not in any way. The vaccine sends instructions to our body to start building up what we need to protect ourselves from COVID-19 if, in fact, we come in contact with it and contract it. Which goes also to another question. People are afraid about the COVID-19 vaccine. It will make them sick with COVID-19 because they've heard some people have had symptoms of COVID-19 after they have gotten the vaccine. And the answer is no. None of the authorized and recommended COVID-19 vaccines or COVID-19 vaccines currently in development in the United States contain the live virus that causes COVID-19. This means that COVID-19 vaccine cannot make you sick with COVID-19. The vaccines teach our immune system how to recognize and fight the virus, which can cause symptoms like soreness in the arm, fevers, being very tired, exhausted, but it's not the virus. And so when you hear people saying, "Oh, I heard someone got the vaccine and then they got sick with COVID-19, they cannot get sick with COVID-19 from the vaccine. It's possible they could have contracted COVID-19 from someone else at the same time they got the vaccines, or as Dr. Burstein just noted, contracted it afterwards, because we do know that COVID-19 can be contracted and transmitted to an individual who has been vaccinated. The vaccine does not stop your body from potentially contracting the virus. It prevents you from getting sick, very sick, to be hospitalized. So those are two important myths that we wanted to bust with the facts. Here's another myth that we've been hearing recently. Children cannot be infected with the virus and cannot spread COVID-19. Fact, children can contract and spread COVID-19 like any other person. Now, while the likelihood of the child becoming serious illness is small, there are and have been children in our community who've been hospitalized due to contracting COVID-19. Yes, it is a smaller amount than adults, but they can contract it, they can spread it, so that's why it's important that we act appropriately. And all you have to do is look at the most recent numbers we showed, where the numbers are exploding compared to where we were just a couple months ago in student age population, and the only age breakdowns that saw increases from week to week in raw cases were students. So we want people to understand that that is another myth and fact. Now I want to talk about another myth. I don't actually have it on a slide, but this was brought up yesterday. Myth: I'm going to demand the resignation of Gail Burstein or fire her. Fact: no. Dr. Gail Burstein has saved countless lives in this community. And the individuals who are out there critiquing her have their right to their opinion, but they don't have the right to the facts. You are not being fired.
That's good.
I think her parents will be happy about that, and her husband. But I want people to understand that people, as the late Senator Daniel Patrick Moynihan said, are entitled to their opinion. They're not entitled to the facts. And what we do is based on the facts. It's based on science. Now, I hear a lot of this. Dr. Fauci talked about it over the weekend. There's one simple fact. The best and quickest way for our county, region, state, and country to return to normal, whatever that was, is to vaccinate everyone. And too many people who are fighting the vaccines want us to immediately open everything. They say, no, I'm not going to take the vaccine, but we need to return to normal. The only way we're going to return to normal is if everyone is vaccinated. And if you want proof, we got some proof in this last week. Israel just eliminated its outdoor mask order now that 81% of its 16 and older population have been fully vaccinated. If you don't believe me, if you don't believe the New York Times, I even cut an article out from Fox News. Israel drops outdoor mask mandate with 80% of adults vaccinated. We know it works. In Israel, they've seen a tremendous drop in hospitalizations and new cases. And now people are able to go out in public and not wear the masks anymore, anywhere. We can't do that now. As Dr. Burstein noted, 38% of our population for the 16 and older population has been fully vaccinated. So we're not even halfway to where Israel is now. And hopefully by the end of May, we will get there because we believe there's enough doses now to vaccinate everyone who wants to be vaccinated, at least 18 and above. The 16 and 17-year-olds have to take the Pfizer dose, and right now we are not getting them. Other local pharmacists, healthcare centers are not, but we do believe that the Pfizer is being delivered to the Delavan Grider site as well as the UB South site. So if you have a 16 and 17-year-old that want vaccinated, and I know this from individuals who got their children vaccinated in the last couple of days, you should contact the Delavan Grider site. You should contact the UB South site. Go to amieligible.com because there are appointments available at both of those sites. There's appointments available everywhere across Erie County. The numbers are better. I'm happy to see the vaccination numbers we have, but we are not where we need to. So help us get back to normal, everyone. Get vaccinated. I can't do it. Dr. Burstein can't do it. We can only do it as a community if we reach a herd immunity. And a herd immunity is not going to happen if 60% of our 16 and 18 and above get vaccinated. We need to be where Israel is, 81%. And then we can go about our business not wearing masks in public anymore. That's what's going to do it. Help us get back to normal. Get vaccinated. And with that, I will open it up to questions. And we will start with Olivia Proya from WKBW-TV.
Hi, County Executive. Can you hear me?
Yes, I can hear you. Go ahead.
So, as we're seeing the demand for the vaccine kind of decrease with all those who wanted the appointment now that have it, it seems like one of the strategies to get people vaccinated is now walk-in clinics. And it's my understanding that other counties are now going to be partnering with schools and community centers to kind of go to the populations that have lower vaccination rates. Is Erie County considering partnering with any school districts? And in addition to that, with the state's mandate that your allotment has to be used within a week, will Erie County be pushing to have that changed? And what happens to unused doses if there's no one to take the shot?
Well, I'll start with your second question. Yes, myself and others are pushing New York State to expand the 7-day requirement because it's not just Erie County, it's other counties across New York State that are starting to see a drop-off in overall demand. So we will do that. We would like to partner with schools, but we can't right now because we don't have the Pfizer vaccine. We have the Moderna, which is 18 and above. So we are working with community centers. We're going to be doing more pop-up clinics, announcing them and walk-in capability. We have a clinic scheduled at the Durham Church and pop-up clinic this Friday in Buffalo. There's 380 appointments available right now, last I saw, or maybe it was 320, and it was over 300. And if those don't change, we'll announce it as a walk-in clinic as well. As the doctor noted, our SUNY Erie North and South clinics today are both walk-in clinics. You can come in. It's better to schedule an appointment. Call 858-2929, schedule an appointment so you know exactly your time. But if you want to walk in, you can walk in. Sometimes you might have to wait a few minutes. Other times you can walk right in, like yesterday at the KeyBank Center, and get vaccinated right away. So our goal is to work with our partners to get it in the community in pop-up clinics. We know not everybody can get to the location of the 3 major clinics, the 2 SUNY Erie sites and the KeyBank Center. So that's why we're having multiple pop-up clinics a week, and we will continue to do that. We are pushing New York State to expand the 7-day requirement. I know doctors' offices that would be willing to take it if they knew they could do it over a greater than 7-day period. And it is something that New York State is aware of because we are not the only county that's starting to deal with this. Western New York counties are all starting to deal with it. I've been on the calls with the Western New York leaders. They are all dealing with it, but other parts of New York State are dealing with it as well. So I would not be surprised to see New York State make that change, and it's something that's been requested by a number of parties. WIVB-TV, Channel 4, George Rickert.
Hi, Mark. Why do you think, can you think of any reason why Western New York's positivity rate is higher than the rest of the state, or has been higher than the rest of the state, other than behavior? Any factors at all that would play into that? I interviewed a doctor today who took a stab at it and said that maybe the fact that the UK variant seems to have taken hold here pretty good, maybe we got the UK variant before the rest of the state, but any factors other than behavior that would explain why we're different than other regions?
I will just give a brief answer and then turn over to Dr. Burstein. We do know that we have multiple variants here, but I do know the UK variant is the dominant variant in the United States right now. So it's not like it's only in this region. It's truthfully across the United States and other parts of upstate New York. Behavior, I think, is a driving factor. We know that where we're seeing it in a lot of new cases, including spread, there was a lack of mask wearing, or an individual. Here's another big one, and I probably should have done it in myths and facts, is vaccination means you can't transmit the disease. You can catch it, you just won't get sick, really, but you could catch it and transmit it. So if you're vaccinated and you go visit someone who's unvaccinated, you could give it to them and they could get sick from it. So that's another one that's a myth and fact that we have to get out in the public, and I think a lot of the public thinks once they're vaccinated, they're like Superman, they're invulnerable, they got bullets bouncing off their body and the virus can't enter them. Well, the virus can enter them, and they can transmit the virus to someone else. But I'll turn it over to the doctor, see if she wants to add any more. So it's great to be Superman, but we're not Superman, nor Superwoman, or Wonder Woman.
As the county executive noted, we assume that there are circulating variant strains of concern throughout New York State and throughout the United States. We're very fortunate. Our University of Buffalo has been really aggressive about getting specimens tested with genetic sequencing, so we have access to our own data where no one else in the state has that access. We have to rely on Wadsworth, which only does a very small proportion of the specimens that they receive. So we have good data. Just because we know what we have doesn't mean that we have more than everybody else, because they don't know what they have. And so it's really not just the variant strains. I agree with the county executive, it's behavior. And it's not just the behavior of not wearing masks, not social distancing. Our contact tracers have told us that people are refusing to isolate and quarantine. When the nurses call people about their positive test results, they say they don't believe it, and they're not going to adhere to isolation, and they're not going to stay away from the rest of their family. And so there's spread within households. We know there's spread within businesses. We see there's spread within daycare centers. We've seen a lot of infections recently, kind of post-Easter gatherings. So people getting together in small gatherings, large gatherings for the Easter holiday. And again, I think a lot of it is people not cooperating and adhering to the isolation and quarantine orders. If people don't adhere to these orders that we give over the phone, we will write specific orders with their name on it, give it to an Erie County sheriff, and they will hand deliver it and serve those orders so they are legally binding. And we have been doing that. And some of the people we serve orders to have been really awful to the sheriffs, like attacking them with dogs, ripping them up in front of their face. And as long as those orders have already been served, it doesn't matter if they've been ripped up. They're still legally binding. So we just need people to cooperate. It's awful to be infected. It's awful to be in isolation. It's awful to be in quarantine. It's just for 10 days. And it's really our responsibility to protect the other people in our household that we work with, in our community, to keep our numbers down. So it is bad behavior, I think, that is driving a lot of our infections.
Okay, WGRZ, Kelly Dudzik.
Hi, so if you guys are dealing with those types of behaviors and dogs attacking people when you're trying to get them to quarantine, how do you reach the populations of people who are, you're going to have pockets of people who are going to refuse to be vaccinated, and at some point these numbers are probably going to plateau. So what kind of outreach can you do to those populations to get the word out, and besides doing what you're doing right now, to explain how important this is?
Well, Kelly, we're trying to work with trusted partners in those communities. We've got a whole new plan that we're going to be implementing in the near future, not only working with members of the clergy, but other individuals in the community that they may trust. We're going to be working with employers. We know a lot of employers have the ability to mandate their employees to get vaccinated, so we're starting to do some vaccination clinics with employers. And we know employers are telling their employees they got to get vaccinated. So some person may not want to get vaccinated, but if they think, hey, I'm going to lose my job unless I get vaccinated, I better get vaccinated. It is not an easy answer, and it's something we're working on. Nobody has the answer. There's no one answer. We're basically doing the throw everything at the wall model and see what sticks. We've done that before. We did that for the opiate epidemic, in which we tried all kinds of things, threw it at the wall and saw what stuck. If it stuck, we kept on doing it. If it didn't stick, we'd try something different. And we're going to be doing that as well. There's just no easy answer. It's disappointing to see us plateauing in vaccinations, but also seeing increases, or at least a plateauing a little bit with new cases, though I expect the hospitalizations to still increase for a little bit of time, because the hospitalization generally comes a week to 10 days after the person initially got sick, and then death often comes 2 to 3 weeks after the person was first got sick. So I wish I had the answer, and we all do, but none of us have the answer. Ron, I'll get to you in the second round. Spectrum News, Dominic Lavallo.
Hey, Mark, thanks. So last week was when you made the announcement that people would have to be vaccinated to go into Highmark Stadium. Clearly, it was met with some backlash by many, and even Governor Cuomo questioned if that was something you had the right to do. Have you had any talks with Governor Cuomo or the state in general enforcing vaccines to get into Highmark? And if you have, what have they been like? Are there any other updates?
Dominic, I never get into the specifics of conversations we have with the state. I mean, I think those are important that we keep those where they are. I had to go into the issue regarding Larry Schwartz because of the accusations and the assumptions of what was put on me. But it's fair to say that our plan is to move ahead with this. I have had good conversations with the Buffalo Bills, and the state is aware of it. I think the governor also noted he sort of backtracked a little, saying yes, it would make sense to have 100% of the people vaccinated. And that's, as I say, the best way we're going to get out of this is vaccinated. If our community is vaccinated by the time we get this, I mean, we're going to be in a situation where mandating vaccines is not even an issue because we've got everyone vaccinated. So I would just note that there's a reason why I announced it when I did in April, so it would give us enough time to work with our partners to put the plan in place so that when it was time to have the first game in August, let's say a preseason game, everybody knew what the rules were and how we were going about implementing it. And that's our plan, and we're continuing to stick with it. And we will work with our partners in New York State, like we always have, and we'll work with our partners with the Buffalo Bills, because we are talking about protecting the attendees, the individuals who are working at the game, which are many, including not just concessionaires and ticket takers, but sheriff's deputies, emergency service personnel, emergency medical personnel, individuals associated that are on the field with the Bills. It's a work in progress, but we're still planning on moving ahead with the plan. WBFO, Michael Desmond. You there, Michael? I know you were there earlier. If not, we'll come back to BFO, see if he's there. Mike Baggerman, WBEN.
Hi, Mark. Can you hear me okay?
Yes, go ahead, Michael.
All right. So our understanding is that there is still a significant amount of overtime that's being earned by some high-ranking county employees. Do you believe the county should reconsider the overtime policy for these employees, such as the health commissioner, such as members of the sheriff's office? And do you feel that the amount of overtime that's been collected is still appropriate given where we currently are in this pandemic?
Well, we did change the overtime rules. I don't know where you're getting your information from, but we did change the overtime rules so that an individual would not be eligible for overtime until such time as they worked a number of compensatory hours that were credited towards their compensatory bank. We are required under the law to provide overtime based on the way our MCs are described. This goes back to a rule that was in place a long time ago. We changed it to change it over to compensatory time, but I think it's fair to say that we are not out of the pandemic. All you gotta do is look at the numbers, Michael. I wish we were. I wish we were done and we could just say, go home and none of you have to work on the weekends, but people are working the weekends, people are working late night. I was at our clinic yesterday and there were individuals there, the Key Bank Center Clinic. They were gonna be there till 7:45, which means to the public, they were gonna be there till after 8, so they could close up the shop, and most of those people came in around 9 o'clock in the day. So people do earn overtime because they're working hard to protect the public. But we did change the rules as it relates to overtime, requiring any managerial confidential to immediately put it into a compensatory bank, which they, by law, have to do anyway. So I think it's a little, I don't know where you're getting your information from, who's saying that, no, we haven't changed it, but we did change it. And it is a change that was brought forth, the legislature agrees, because it had to be approved by the legislature, and we think it just says that going forward, we are not telling employees who are working very hard, you're not gonna get paid for your service, because you can't do that, but we are also telling individuals that there is a limitation on how much overtime could be earned. The Buffalo News, Sandra Tan.
Hi, it's Barb O'Brien.
Hi, Barb. Yep.
Hi. Some school officials are feeling the county health department is being too harsh on quarantine and pause requirements, especially compared to counties elsewhere. I'm just wondering what you have to say to that. And also, were there any cases in the last week that were transmitted in schools?
Regarding the first part, I would note that we are following CDC guidelines. We don't make the rules. We've said that before. It's the CDC that makes recommendations, and New York State issues the actual rules, and that's what we're following, are the New York State rules. Schools have the opportunity to reopen at 3 feet between the students. They can do that. They have to be wearing masks inside. There's some that are saying, oh, you don't need to wear masks anymore. That is not true. CDC recommends it, and so does New York State, actually mandates it. And then even the CDC says we shouldn't even be doing indoor sports. Under the CDC guidelines, we shouldn't even be doing indoor sports, but indoor sports are allowed. So as it pertains to the issues associated with opinions, people are entitled to their opinions. School superintendents are entitled to their opinions. And not every situation is the same. I will granted that. But we also have to look at the big picture of where we are. And right now, we're still one of the worst counties in New York State. So I really, at this point, it doesn't matter to me what's being done elsewhere if their case rates and transmission rates are much lower than ours. We know where our numbers are. And I will back up the health department. They are the fact-based folks, and they're the scientists. And if they say this is how it should be, then I'm like, okay, that's fine. You're the health department. You make the decisions, not me. I want to know that it's based on facts, and if it's based on facts, so be it. It's like the issue associated with the football game, town of Alden, and I didn't see it in any reports, but I actually talked multiple times to the superintendent of the Alden school districts this weekend. I talked to the supervisor of the town of Alden. And why? Because we were trying to resolve this issue so people understood that last Monday there was a game between Gowanda and Alden in which 3 individuals who tested positive on Wednesday played in that game for the Gowanda team. And one of them, it turns out, was symptomatic during the game in which they played against Alden. And we made a recommendation that we didn't think it was appropriate for the game to go on this Saturday, and that the students that were involved in the game and were in contact with these other ones with Gowanda should be put in quarantine. We asked for that list. The superintendent provided the list of everybody on the team. I talked to him. I said, if the student didn't go on the field or was the kicker who didn't come in contact with other people, probably don't need to be quarantined. We got finally a list back that identified, I think, the 21 individuals who were the ones that were playing predominantly in the game and probably came in contact with the individuals from Gowanda who were symptomatic. And as we know, you can shed virus even if you're asymptomatic 2 to 3 days before you start showing symptoms. So there were 3 players from Gowanda who were sick with COVID-19. 1 was symptomatic, 2 were asymptomatic, but they were shedding the virus. I'm glad that in the end, the game was canceled between Alden and JFK this past weekend. And I'm glad not every student was put in quarantine, and that was done after discussions in which we finally found out who the individuals were that were most at risk. So we are working with the school districts. Not everybody likes the answer. I get it. But I would have been pretty furious if I was a parent of a JFK student and I knew my kid was going to line up across the line from a player on a team that just had been exposed to COVID-19 6 days before. So we have to do what's in the best interest. And with regards to in-school transmission, we have a lot of cases of students. The in-school transmission, it's always very difficult to determine where the source came from. We are aware of in-school transmission. There's no doubt about that. We do know of cases. I'm not certain if we have the case data with regards to in-school transmission for the most recent period.
None, this past week, we've seen a lot of transmission within sports.
Okay, none directly in schools, but multiple transmission in sports teams, which of course are a school-based activity. So maybe none in a classroom that we can confirm, but we can confirm multiple cases in the past week of high school or modified, whatever it is, age student activity that is sports related. Okay.
Sports related with the schools?
Yes. Yes.
Okay, so wouldn't that be, that would come under being transmitted in school, I would think, if it was a.
Well, yes, but what we're, see, the problem is, Barb, is there's a lot of people out there saying there's no transmission in schools and they're stopping as if it's the classroom only. We are seeing transmission in schools associated with school sports. We have seen transmission we've been able to determine that is solely in a classroom. We haven't been able to determine solely classroom transmission, but we have been able to determine transmission from sports teams associated with schools. So I have to put that little differential there. Is it school-related transmission? Yes, it's school-related transmission. But there are people out there who are trying to use the argument there's no transmission in schools and limiting that to the classroom setting. And we know that's not the case because there has been, but even if there wasn't in the most recent week, there's been multiple cases of transmission between players on sports teams that are school-related. Sandy, I'll come back to you if you have a question, or we'll ask Sam Yarnell of WRHU, yes. Sam, if you're still on.
Hi, Mr. County Executive. Can you hear me all right?
Yes, I can. Go ahead.
Awesome. I just wanted to bounce off something that Dom brought up a little bit earlier. Last week, when you made your announcement about your plan for vaccine passports and the Excelsior Pass for fans to get into Highmark Stadium, it was initially met with some skepticism. But as the week progressed, we actually saw other teams start to implement similar types of programs, namely the Wisconsin Packers, or the Green Bay Packers in Green Bay, Wisconsin.
Yeah.
I'm curious, why do you think that Erie County specifically and New York State were the best to kind of spearhead this movement of requiring people to be fully vaccinated before re-entering large gathering events like sporting events and concerts?
Well, thanks, Sam, and I do appreciate you bringing up that we were the first to announce it, but we're not the last. And I think the reason is because the Excelsior Pass that exists here, we have the ability, once you're vaccinated, to, if you're in the state NICES system, to identify, yes, you've been vaccinated, you can download the pass, you can print it out from the internet on your home computer and then bring it. It may not be the only mechanism that's used. We're looking at and see if there are other mechanisms that potentially could be used, because we know that there are individuals that attend our football games that come from outside of New York State. We also know that there are individuals in New York State who've been vaccinated through like the VA site that might not be listed through the state's nicest background. So we are looking at that, but I think it's important for the public to know, as I said earlier, the only way we're going to return to a time where it's normal is if everyone's vaccinated. So I think it's important that we move in that direction, and I announced it early enough so that we gave our community, along with working with the county, the bills, and New York State, the time to ensure we have a good mechanism in place to ensure that it is a safe environment. Otherwise, we're going to be going back to only a certain percentage of the population or the certain number of fans will be able to attend the games. And I guarantee you nobody wants that situation. We want to be in a situation where 100% of the fans are in the game. Why don't we go up quickly? We'll do a rapid. I have to be on a conference call at 3. But Buffalo News, Sandra Tan. Sandy, any other questions? Do rapid fire round.
Yes, I did. I'm interested to know, over the past week, since you have allowed walk-ups to come into county vaccination sites, there still seem to be lots of appointments left at the end of the day. I'm interested to know why you feel like these appointments aren't being taken at this point, given that people can go right in essentially the same day. And also, I wanted to know if you had any additional information about the program the county is spearheading to vaccinate homebound residents, when you think that'll get started, and your hopes for it.
The homebound, we were using the J&J. Until we get J&J, we're probably not going to be able to do a whole lot with that. If an individual contacted us who's homebound and said, I want to be vaccinated, I'll take the Moderna, we'll go out there and do it. It's easier with the J&J. We do have a specialized task force that does that, and we've worked with our partners, Buffalo Home Care and VNA, visiting nurses, to do that. Regarding the first question, just remind me once again.
It's about why more people aren't getting vaccinated, even though
Walking
there's a lot
up.
of walk-ups.
Yeah, I'm not certain, other than we really don't announce the walk-ups until the day of. We're thinking about setting up some clinics that we're going to announce the walk-up days before, so people can schedule it and know I can walk in there that day. I'm not exactly certain. The first few days we did walk-ups, so we had lots of people showing up. The South Side one we had this weekend at Southside Elementary, we had a lot of walk-ups. Last night we didn't have a lot of walk-ups. It's also downtown in the KeyBank Center, and there wasn't a whole lot going around. If we were in a neighborhood like we were with Southside, it probably would have been better. But we're going to experiment with that. We may announce the walk-ups days before so people know that they can show up without having to schedule an appointment. Though I think it's always better to have an appointment scheduled so we know you're on there and you have it, you know in your calendar you're scheduled to get a vaccine appointment. Mike Baggerman. Any more questions, Michael?
I have just one more. Wondering if you're going to have a vaccine requirement for Blue Jays games in Buffalo. And is it the county's call, since the city of Buffalo doesn't have a health department?
Well, we don't own the facility. If it was up to me, we certainly would be vaccine only, but we don't own the facility. So it's a little different between the KeyBank Center and the football stadium, is that we own those. The city of Buffalo owns it. The city doesn't have a health department. We can make a recommendation at that point, but we cannot mandate it like we can for the county-owned facilities. Mike Desmond, are you lost in the universe, or are you out there? Come on, Michael. I know you're there. I guess he's not there. Spectrum News, Dominic Lavallo, any more questions? If not, WGRZ, Ron Plants. Ron, are you there? It's the lightning round. I got to get on a conference call in 2 minutes. I guess not. Maybe your question was answered. Channel 4, George Rickert. Any more questions?
Yes. Hi, Mark. When it comes to kids getting it at a higher rate, I know you talked about sports being a big possible spreader, but what about spring break and vacation? Is there much evidence to imply that some of the high rates among students is because of spring break or travel?
Yes. We are aware of quite a number of students who are on spring break. It appeared to have caught it on spring break. It's not definitive. It's not like every student is, of course, spring break related. But yes, we are aware of it, and it is something that we've had to work with the schools, including a number of schools which had some higher number of cases than usual, and almost all of them, not all, but almost all of them were related to spring break, at least last week. This week's cases are different because now we're starting to get a little bit of time away from the spring break period. But yes, the answer is yes. WKBW, Olivia Proya, last question. Any more questions?
Yeah, can you explain what happens to unused vaccine doses?
Well, first off, we don't unfreeze a certain number of doses until we know what we have that day. But once you unfreeze them, you have a timeline of basically 10 days in which you have to use them. So the issue is if we pierce a vial. Once we pierce a vial, we have to use that whole vial. So if we don't pierce a vial, we can just leave it. We keep them. We have actually specialized coolers in which the temperature is monitored all time at the facility, the clinic. So we have our big vaccine freezers. Then we have these special coolers which monitor the temperature at all times, so we know what the temperature is once it's been defrosted. We don't pierce a vial unless we know we're going to be able to use that vial. So for people thinking, oh, if there's hundreds of vaccine appointments that go unused, I mean, there's hundreds of vials that are no good. That's not the case. The doses are not utilized. They can be kept in the cooler, and they just need to be used basically the next day. So it's all part of our calculation of how many doses we need at any one time. With that, I want to thank everyone for participating in today's press conference, and just finish with this one simple fact. Help us to get back to normal. Get vaccinated. Israel, they got rid of their outdoor mask mandate. 81% of their 16 and older population have been fully vaccinated. We're at 38%. Let's get to that 80% number where we can then drop the masks outside. Help us to get back to normal by getting vaccinated. Thank you, Kendra. Thank you, Dr. Burstein. Be safe and well all.